Hi viewers, today in this lecture we are going to learn about the Apgar score. Apgar score stands for appearance, pulse, grimace, activity and respiration of the baby. Dr. Virginia Henderson was introduced this Apgar score. According to this protocol, every hospital they need to follow this criteria to check the Apgar score for the newborn babies to identify the health status of the baby. So this is the criteria. Here I am giving criteria and score is 0, 1 and 2. What criteria we need to check here means first criteria appearance. How the baby is appearing means what is the color of the baby. The normal newborn baby color is, body color is that is pink in color. Other than pink, any abnormal color like blue color or any pale color or body is pink but only extremities are blue. That is also one of the problem for the baby. So you need to give this score. And second criteria you need to check, that is pulse rate. Pulse rate under this 0 may be absent, 1 less than 100 breaths per minute. Under the criteria 2 more than 100 breaths per minute. And coming to third criteria, you need to check the reflexes response. In the under 0 may be floppy. Under 1, minimal response for your stimulation. Under 2, there is a good response after your stimulation. And activity of the baby body. Under 0, there is no active movement of the body. There is completely no activeness. There is no movement of the body under the 0. And under the 1, some flexion of the limbs will be there. And under the 2, active body movement is there. And respiration under 0, absent of the respiration. Under 1, slow and irregular respiration. And under 2, vigorous crying. So this how we are giving this score. See, first criteria is appearance of the skin color. Means we have to check the newborn baby skin color. Under the 0 I am writing here blue or pale. Under the 1 pink body and blue extremities. Under the 2 body is pink. So in these 3 columns, if your baby is having blue body or pale body, you need to give this score 0. Or your baby is having pink body but blue extremities is there, you need to give the score 1. Otherwise, baby body is completely pink. There is no blue color, there is no abnormal color. Directly you can give one score opposite to the appearance of the skin color 2. Means like that 3 columns based on that 0, 1, 2 what criteria the baby is having, that score you need to give under the appearance of the skin color. And the second criteria to check the pulse rate. Under the 0 I wrote absent. Under the 1 less than 100 breaths per minute. Under the 2 more than 100 breaths per minute. In these 3 columns what is that baby? Already first baby we are checking first criteria. Skin color already we checked. Maybe the baby color is pink, you need to give score 2. And second criteria also you need to check the same baby. If the baby pulse rate is less than 100 breaths per minute, it is there under the 1. So you need to give score 1. First criteria we are giving 2 means body is pink. That's why we are giving the 2. Otherwise body is pink and blue extremities 1 we are giving. But maybe that baby is having pinkish body. That's why 2 you can give. Coming to the second criteria, pulse rate. The baby pulse rate is less than 100 breaths per minute. So you can give score 1 under this column. And third criteria you need to check grimace. Means reflex response. Here already you know so many reflexes we are having. Rooting reflex, sucking reflex, swallowing, Babinski reflex, Moro reflex, plantar grasp reflex, sneezing reflex, stepping and dance. So many reflexes are there for the newborn baby. According to this Apgar score, you need to check the reflexes also. We need to assess the central nervous system function of the baby. So here what is the response the baby is giving after your stimulation? Means the baby is active or not, the baby is giving response or not for your stimulation, that also you have to check. Under this 0, reflexes response, how much you are stimulating also, the baby is no responding completely, that is called floppy, you can give 0. Otherwise, minimal response, some little bit response the baby is giving after your stimulation, you can give score 1. Okay, immediate stimulation, the baby is giving active response. Good response, what we are expecting, that response the baby is giving, you can give 2. Means based on this criteria and based on this values, you have to keep the score. And 4th criteria is activity. What is the baby limbs movement? The baby is not moving his limbs, upper limbs and lower limbs, and the body also, there is no movement of the body. You can keep absent under the 0. If there is no movement of the body, 0 you can give the score. But somewhat flexion of the limbs the baby is keeping, 1 you can give. There is no active movement, you can give the 0. 1 flexion of the limbs, somewhat flexion of the limbs, 1 you can give. Active movement of the body is there, directly you can give the 2. Score you can give. And last criteria you can see, that is respiration of the baby. There is no respiration, the baby is not taking respiration, you can keep absent, means that is the 0. The baby is not having respiration, directly keep score 0. Under the 1, slow and irregular. The baby respiration is very slow and irregular, 1 score you can give. And vigorously crying, active crying, the baby also having active alert look, you can give 2. After your scoring, you can count the score. First what we have given, first criteria, pink body, 2 we have given. Pulse rate 1, means less than 100 breaths per minute. For example, I am telling this. 2 plus 1, 3. Grimace reflexes response, you told. Minimal response to the stimulation, 1 I am giving. Activity, active body movement, 2. Respiration is slow and irregular. Now you can count. 2 plus 1 plus 2 plus activity 1 plus 1. So what is the score? You can count it. Maybe 6 to 7. Means the baby is having moderate health issue. If the score came 8, 9, 10, the baby's health condition is good. There is no further treatment. Directly we can hand out to the mother for the further procedures. But after your criteria checking, after your scoring, the baby got 3, 2, 1. The baby needs emergency treatment. So for the each and every newborn baby, according to this criteria is not changing. But values of the each and every baby will be changed based on their appearance, based on their pulse rate, based on their reflex response, values will be changed, based on their activity of the body, also values will be changed, and based on their respiration also, values will be different. But our expected value is 8 to 10. The score came 8 to 10, there is an active baby. Below the 8 means 5, 6, 7 also moderate problem the baby is having, and 1, 2, 3 severe problem the baby is facing. Without thinking anything, immediately we need to start the resuscitation of the baby. So that is the purpose we are checking the Apgar score of the newborn baby. Thanks for watching.